Sources and body effects of drugs. There are 5 main sources of drugs. The first one is plants. Typically we get our digitalis for digoxin, and then poppy plants, which produce opium for our opioid analgesics. The second category is minerals, such as magnesium, zinc, potassium, and iron. The third is animals, so thyroid hormones. The fourth is synthetic or manufactured drugs, which is many drugs today. Most classes of drugs are synthetic. Our hypertension drugs, Lomotil, Demerol, are all examples of synthetic manufactured drugs. The advantages to synthetic manufactured drugs is that they are produced in large quantities for a wide market throughout the United States. Number 5 is genetic engineered. Our vaccines, insulins, and growth hormones are all classified under the genetic engineered classification. These drugs are created in a lab, and then they're produced in mass quantities, and then they reach the market. Investigational new drugs are drugs under research. They are not approved by the FDA for wide marketing. They are approved by the FDA for research in people only. Typically, they have undergone animal research to reach this stage. The most recent drugs of note that are marketed at this point are the hepatitis C drug. Harvoni is the newest approved drug by the FDA after significant research. Some of the drugs that are on the table for investigation right now are the Ebola vaccine and the tick-borne illness vaccine. There's a lot of research being done in these two areas to see if we can create a vaccine to prevent these illnesses. Effects of drugs. Systemic effects. This means that the drug affects all areas of the body. It has some sort of effect throughout the entire system. The local effect type of drug is your lotions or your lidocaine patches. That's why we call it like a local anesthetic. It only affects a certain area of the body. So wherever we place that lidocaine patch or give that lidocaine injection, that is the only area it will affect. Pharmacokinetics. The definition is what happens to the drug as it moves throughout our bodies. So there are 4 different types of processes which we will go through in depth. The first one is absorption, then we have distribution, metabolism, and excretion. Absorption is the passage of a substance through a membrane into the bloodstream. So the sites that this can happen are the stomach, mouth, intestines, and rectum. There are many variables as far as absorption. So if a medication needs a more acidic environment, it will be absorbed in the stomach. If a medication needs a more alkaline environment, it will be absorbed in the intestines. The second variable is lipid solubility. So if a medication needs a higher lipid solubility, it will be absorbed in the stomach. If it needs a lower lipid solubility, it is best to give that medication in a different means other than an oral type means. So either IV or intramuscular injection, those sorts of means. The third variable is food in the stomach. Some medications we need food in the stomach to help absorb that medication and decrease irritability in the stomach. Some we need a decrease of food in the stomach or no food prior to taking to increase the absorption of that medication. Distribution. Distribution is moving from the bloodstream into the tissues and fluids of the body. So the site that this happens is the circulatory system. There is selective distribution, which means there is an attraction to the drug to a specific organ or cell. Sometimes this can happen with our cardiology drugs. Sometimes it can happen with our respiratory drugs, which we will go into a little bit later in this class. Metabolism is the physical and chemical alterations that a substance undergoes in the body. Sites are liver and small intestines. The liver breaks down drugs into metabolites so kidney can excrete them. So if a patient has liver or kidney disease, they will have a harder time metabolizing a drug or excreting a drug. So we really have to watch liver and kidney functions in patients in order to not make these drugs harmful to them. Prodrugs are only where they become active when they are broken down by the liver. A good example of this is Plavix. It's probably one of the very few examples of a prodrug. But Plavix needs to be broken down by the liver before it can activate and aggregate platelets. Excretion. Eliminating waste products from metabolism, so sites, kidney, intestines, sweat glands, and lungs. There can be a cumulative effect where a drug builds up, or a toxicity effect where exposure becomes unsafe, where those levels become toxic and unsafe and can harm other body systems within our body. The therapeutic range is the range where we want the drug to be, the range that is desired to cure whatever we are trying to cure. So like a hypertensive medication, we have that therapeutic range that we want it to be, and we monitor it by taking blood pressures. So here's an example of where the toxic levels meet. Lithium, digoxin, and theophylline can be very dangerous when they reach toxic levels. So we just need to remember that 2.0 for digoxin and lithium, anything over that is toxic. And then for theophylline, 20 micrograms per milliliter is toxic. Theophylline is really rarely used today. The main two that we really have to remember here are lithium and digoxin. And we usually take these levels through a serum test, a blood test, and we can either take those levels either at trough or peak. So trough is where the patient has not taken any medication, 24 hours or 12 hours, depending on the drug, prior to that lab being drawn. The peak is usually taken an hour after the patient has taken the medication to see where they are at while they are taking that medication. So it's really important to ask our physicians whether they would like a trough or peak level with these drug levels. Other variables, age. So obviously pediatric patients may need less medication. Our obese or overweight patients may need more medication. Gender, females, hormones often interfere with some medications. Also, the ratio of body fat can also interfere with the medications and how they are absorbed. Psychological state. We can have the placebo effect. This is often given in blind studies and research. The placebo effect is where there's an inactive agent that resembles a medication where there is no drug present. So pretty much it's a blank pill, but the patient really thinks they are actually taking a medication when they aren't. Synergism is where action of two drugs working together simultaneously gets us that therapeutic effect. So most commonly, many people are doing this with antihypertensive medications. So they are taking a beta blocker and an ACE inhibitor in order to get that therapeutic effect and get that blood pressure down. Potentiation is where there's two drugs, one prolongs the effect of the other. This oftentimes happens with Plavix. We prescribe aspirin to get the effect that we need to aggregate those platelets to reduce clumping. Antagonism. Two drugs. One decreases or cancels out the effect of the other. The drug that comes to mind most often with this is Narcan, that we use when patients overdose on specific certain medications. We will give Narcan, which is antagonism. Some interactions that we have are Tylenol and antibiotics. Tylenol may cause an interaction with the liver processes while a patient is on antibiotics. Aspirin and diabetes medications. Aspirin will actually raise the blood sugar, making the diabetic medications less effective. Benadryl and sleeping aids, well, they both cause sleepiness and can cause severe effects on the central nervous system. Antidepressants in St. John's wort can cause serotonin syndrome, which includes diarrhea, delirium, and more. Anticoagulants and vitamin K, they work opposite of each other. So vitamin K causes our blood to be thicker. Anticoagulants, we want them to be thinner. So there's also obviously an interaction there. That's why we coach our patients to take a consistent vitamin K level, have a diet consistent vitamin K. Birth control and antibiotics. Antibiotics can sometimes render birth control ineffective. Cholesterol meds and grapefruit can cause kidney damage and weakens the muscle fibers, can cause muscle cramps, those sorts of things. Asthma meds and coffee are also dangerous. They increase the heart rate and blood pressure. And then blood pressure meds and licorice can cause a hypersensitivity in the hormones in the adrenal cortex. Dosage. So this is the amount of drug given to get the desired effect. Dosage levels, so the minimum dose obviously is the smallest amount that we can give. The maximum dose is obviously the largest amount that we can give without toxicity. A loading dose is the initial high dose. So sometimes we do this in cardiology with Plavix. If you had just had a stent placed, we will do a loading dose of 600 milligrams of Plavix, and then there on out we will do a maintenance dose of 75 milligrams PO/QD. So maintenance dose keeps the blood level consistent, and then a toxic dose is a harmful side effects. Lethal dose causes death, and therapeutic dose is what is customarily given to treat patients of a disease. Routes of administration. So we have internal, which is oral, nasogastric tube or NG tube, or rectal. Parenteral, any route other than the GI tract, which includes sublingual and buccal. Injections such as intravenous, intramuscular, subcutaneous, or intradermal. Then we have the topicals, which are dermal, mucosal, or transdermal patches. And then we also have our inhalants. Lastly, I want to talk about adverse drug reactions. We have teratogenic effects, which is a maternal drug administration causes physical defects of a fetus. So there are 5 categories of adverse reaction or pregnancy categories on all drugs. The first category is pregnancy category A. There's no risk, and there has been human studies done, so patients can safely take those medications in that class. There's class B, which has no risk, and the only studies that have been done are on animals, so not done on humans, but is generally thought to be safe for the patient to take while pregnant. Then there's category C, which no studies have been done, either animal or human. So we really don't know the effects, so it's kind of at your own risk. Category D, which risks the fetus, so all patients on these types of medications in this class should be taken off while pregnant. And then category X is the teratogenic effects of the fetus, which is contraindicated for anybody who is pregnant. So categories D and X for pregnant people should not be taking those medications, and their medications should be switched during that time. So if you look in your drug references, you will see the pregnancy category that each drug is. So it's very important to acknowledge that, especially if you're working in OBGYN or family practice. Idiosyncratic reactions, which is unique, unusual, and unexpected response to a drug. Paradoxical reaction is the opposite effect of that is expected. So some people, everybody acts differently to drugs. That's why there's so many drugs out there, and there's always a different philosophy among physicians and how they prescribe things. But some people react totally differently to certain drugs that maybe everyone else does. And this is what we were talking about here. Tolerance is a decreased response to a drug after repeated doses. This is very common among our narcotics. Dependence, acquired need for a drug that produces psychological, physical symptoms of withdrawal. So psychological, that need, that want, that obsession that patients go through. The physical, you will also sometimes see shakiness, jitteriness, cold sweats, high blood pressure. I once had a gentleman that was going through withdrawal because he was dependent on certain opioid analgesics, and he didn't have any. He ran out. His blood pressure was 230 over 130. So, and it was really loud and snapping when you were listening to the blood pressure. And that was a withdrawal effect that he was having due to his dependence on those drugs. Hypersensitivity is an immune response, an allergy, and then an anaphylactic reaction is a severe allergic reaction where people are most likely unresponsive.